Hello, guys, it's me again. Today I'm back with a more serious topic, a more serious illness that I have, which is lupus. As I said, it's systematic lupus erythematosus, but shortening it, we just say it's lupus. I'm going to tell you how I got lupus and how it's been going with it, right? I also got lupus when I was 21. I was sick, man. I was sick. I was very sick. I thought it was because of the rheumatoid arthritis. When I was admitted into hospital, they started checking my urine because it was producing blood. So they started checking things like that. They asked me what other symptoms I'm experiencing, and I told them that I'm experiencing a pretty bad rash. I'm experiencing my hair falling out. I'm experiencing fatigue. Yeah, I told them a lot of things. I wrote notes down because I didn't want to like forget, because it's a long story. It's a very long story. And then I had mouth ulcers inside my mouth. So after telling them everything, they were like, okay, we're gonna come back to you with the results. And I was discharged, went home. When I got home, they called my mom, told her that no, this person has full blown SLE. They're not just saying it's SLE or it's lupus, they're saying it's full blown, meaning it has done its worst. And I had to accept that. They told us to come so that I can be admitted into hospital so that they can look into this. Remember, it was a public hospital. I got there and they just told me, no, she looks clinically okay, so it can't be that bad. Number one, a person who has lupus looks clinically fine. I look okay. I look fine. I don't look sick. I don't look like maybe I'm gonna pass out soon. I look normal. That's what frustrates me a lot about lupus. It's you look normal, so people don't understand when you explain or you tell them about this illness. Okay, number one, let me explain what lupus is. Lupus is an inflammatory disease, right? And then it's caused when the body cells attacks the tissues, its own tissues, meaning it's the body attacking itself. My body is attacking itself from the inside. Let me tell you about the symptoms. I've already told you about the symptoms that I've experienced. So now I'm going to tell you about the symptoms that are there that you might not notice. The symptoms, some of these I experienced. Pains in the muscles I did, chest pains, anemia I did, skin redness I did, mouth or dry ulcers I did, hair loss I experienced, and then the other ones they just like feel like normal but they really are not. Anxiety, blood in urine, clinical depression, face rash, flare-ups, headaches, joint stiffness, swelling, and sensitivity to the sun. I'm very sensitive to the sun. If I'm like exposed to the sun for a long time, I really get sick. I really get a flare up. So yeah, that's number one. And then there is the treatment part of it. There's no treatment for lupus. As I told you, it's incurable. So there's no treatment whatsoever for lupus. But the something they can give you, it's pills to minimize the flare ups, and then it's the immunosuppressants that help you with your symptoms and stuff. And then there's a mortality rate which says a person with lupus, 80 to 95% of people with lupus after getting diagnosed only have 10 years to live. I can attest that's a lie. Not saying I've lived past 10 years after being diagnosed, but I've seen people living 10 years after diagnosis. So lupus, I experienced a lot with lupus, guys. I experienced a lot. I thought I was dying with this thing. I'm still experiencing a lot even right now. Like my body would just be in pain. I wouldn't want to do anything, wouldn't want to touch anything because I'm in pain. And the joint stiffness is the worst. It's the worst because you can't do anything. You cannot touch anything, you cannot do anything. Your body just feels stiff. So with lupus, I get very sick. I get admitted into the hospital a lot. I'm in a private one now, which is a whole lot better. I get admitted into hospitals a lot. I was admitted into hospital. I don't know. Was it last year June? Last year June, I was admitted into hospital and I was told that I have pulmonary embolism, which is clots in the lungs. Because I was having these strange, weird chest pains. So I went to the hospital. The doctor just conducted the test and they told me that, oh no, you have pulmonary embolism. And with pulmonary embolism comes with taking pills every day at 6 o'clock. You can't miss that time. Every day at 6 o'clock, you must take your pill. Every end of the week, you must go and do your INR testing to know that I need to drink this amount of dosage. So if you don't go to your nearby pathology lab, you won't be able to know these things, and you're only taking yourself back because you can again develop more lungs. You can again get sick, get pain. You can again, it's a lot. It's a lot. You can get a lot of things from this from this lupus. Lupus comes with a lot. It comes with a lot, and it's really straining. It's really straining. It's honestly straining. And then I'm going to talk to you guys about how lupus led me to having bipolar and MDD, because I developed these illnesses because of lupus, because of the stress that I was that I'm under. So I'm going to tell you guys about how I developed these things because of lupus. I hope you guys enjoy the rest of your day. I hope I will. And I'll see you next time with another story.